Okay, we are here with Jane Garcia, the CEO of La Clínica de la Raza. We are the Center for the Critical Study of the Health of the Latinx Communities. We are under the umbrella of the Latinx Research Center at UC Berkeley. We are going to interview her and to know a little bit of the story of this great woman that has been a change maker for la salud de la comunidad latina, especialmente la comunidad migrante y la comunidad disenfranchised here in the Bay Area. Okay, James, if you want to say something.
Es un placer estar con ustedes aquí. I am so happy to be able to document the story of La Clínica. I think we represent a version of the movement that's very important, and its genesis is here in the UC Berkeley campus. And so I think that makes it even more special, and I look forward to being able to tell you at least my journey and the insights that I've learned over the years. And I think it's an exciting story.
Thank you very much. Well, and we wanted to say here that we are accompanied by the staff member of our project, the Center for the Critical Study of the Latinx Communities in the Bay Area. We are here with Nancy Garcia, who has been an undergraduate assistant research, and Carolina Talavera is our postdoc, just graduated from the medical anthropology from UC Berkeley. And saying that, we are going to begin with our question.
Introduce yourself.
Yeah. Thank you. Thank you. I'm Clara Mantini-Briggs. I am a physician and I am the co-director of the Center for Critical Study of the Health of the Latinx Community here in UC Berkeley. And I am co-directing this project with Dr. Charles Rick, that is not here for the moment. We wanted to begin with first question. James, could you tell us about yourself, your trajectory, from when you began pursuing the health career?
I am originally from El Paso, Texas. And I had the great honor of being part of Yale University. And in fact, I was part of the early classes of women. Yale had just started to accept women, and I was part of that introduction. And I thought I wanted to be a doctor. And so my freshman year, I started to, dabble in chemistry and biology and all the pre-med courses, and I quickly decided that maybe that wasn't my cup of tea, but I knew I wanted to stay in healthcare. And I grew up in El Paso as an uninsured kid. I didn't have a medical home, that's for sure, and we got our vaccinations through the community center, our vaccinations through the schools, and the only time you went to a doctor was if you were really sick. And so I wanted to be part of healthcare, the healthcare movement. And as it turned out, I actually got to volunteer at the New Haven Community Health Center. It just happened that I was able to work there. And so I got a glimpse, a very short glimpse, but I got a glimpse into the community health center movement, and it kind of stuck in the back of my head. So that's really how I started. So then I got a summer job in Berkeley, working for the public health department, actually. And I shortly thereafter applied to the School of Public Health, and I got in, so I was really excited about that.
Really?
And we were required to do a 6-month internship, and so I did my internship at La Clínica. And La Clínica was small, we had a budget of about $2 million, I guess. But it was starting to grow, and La Clínica was founded by UC Berkeley students. They were part of the Chicano movement. They were part of the student movement, and they were very much vested in social justice, in making sure that everybody had access to quality of care. And this group of students did a survey of the Fruitvale area, and what they learned was that our community members didn't have access to health care. And through that survey, they ended up deciding to create a free clinic. And but they were fighters. They were social justice warriors, and quickly moved the clinic from being a free clinic, to being able to secure dollars from both the county, Alameda County, as well as the federal government. And the importance of that was that it really stabilized the organization. It was all about the sustainability. And even though we started out, with the medical services, shortly thereafter, we also partnered with UC Berkeley School of Social Welfare. So within like 2 or 3 years of actually incorporating, we added behavioral health services, and the School of Social Welfare was a big, big partner. So they were the pipeline, and they were helping us create that service as well. And then UC Berkeley also had an optometry school. So guess what? From the very beginning, we also had optometry services. Now, we had a small site there, and I remember, I think the bathroom, there was a plank, and it would come down, and we could use it to examine people's teeth. So we were short in resources, but heavy in ganas, heavy in mission, really heavy in wanting to change the world and to have an impact in our communities.
Wow, eso es maravilloso, ¿no? Y es muy inspirador. Thank you for being here, for telling us. No sé si ahora a pregunta.
Yeah. So for our next question, I'd just like to start off by saying it's such an honor to be speaking with you today. I know many peers and people that I know that are volunteers and workers at La Clínica, and to be able to talk to you is just such an honor. So thank you again. I'm in awe of everything you have done with the research I've done in the past semester. Seeing all the accomplishments La Clínica has done for the community has been inspiring. Thank you. But for our next question is, if you could talk more about La Clínica and how community-based organizations made you feel that you had to do something in order to get involved.
I think I came into La Clínica during a moment of growth. And when I started there as a student, we didn't have much infrastructure. So pretty quickly, I got exposed to different aspects of what the organization was doing. Planning, needs assessments. I think one of my first jobs, because we were trying to get the area designated as underserved, which meant additional revenue, especially workforce for us. And one of my first tasks was to find out if a family, if a mom in a stroller with their child had to take the bus to come to us, how long was it going to take her to get there? And to measure that and document that, and to be able to prove what an impediment that was for families, for our patients to get to our services. And so that was part of documenting that and getting on the phone and calling other providers to see, are you open? Are you accepting patients? And to put that all on the record. And so we were able to get the area designated, but it was constantly opportunity to make a difference. And so that really, I was growing. And even to this day, there's constant challenges, but from each of them, the opportunity to grow, the opportunity to add additional services. I would tell you that right now is a very exciting time, especially post-COVID, where we're making a lot of changes and we're part of a lot of changes. And that it just is so motivating, and it's such an important part of why I wanted to stay in the movement. And if you were to interview like a number of the employees at La Clínica, you would find that a lot of us have been there 30 years, 40 years, a number of years. And even more recently, what I've learned, and we're documenting this, is finding some of our young employees who were their mothers were delivered by our obstetricians.
Oh, wow.
And I get goosebumps just telling you that. In one quick moment, I've been able to document like 15 employees who are La Clínica babies.
Oh my God.
And just to see that kind of impact and the passion that our employees show for our mission, it's a driving force. And I think we've been so blessed to be able to make changes that are impactful, and I know we will talk about that. But that's a driving force for why we stay in the movement, and why our employees are such an important aspect of the mission and the ganas.
Now, Carolina.
Well, I'm so curious because you started as an intern and now you're CEO. If you could just tell us about like what, how you made those steps, that would be really interesting to hear. Also because as a woman also in the movement, I'm sure it's really significant and important to hear about.
Yeah, I think it was just really, there was so much opportunity and so much need and very little infrastructure that I really got the opportunity to just keep moving along. And some of the people that I was working with too were, I met them at the School of Public Health as well, so it was a connection there. But I'll tell you, for example, one of my first jobs as an intern was to develop the policies around a new program. It was called OB Access. And that program was about the infant mortality rate in the Fruitvale was horrible. It was out of control. And we had been able to secure some dollars to try to make a difference in those numbers. And my job was to document and create all the policies around this new program. And I want you to know that after our work and doing this work for, I don't know how many years, 3-4 years, that we actually, it turned out we were a pilot, and that program is now, it's a perinatal program that exists for everybody to be able to access and to take advantage of. But there was a moment where they're saying, well, you guys were so good at lowering the infant mortality rate, you almost did away with the need. So it was really exciting to be able to be part of that and to document that. And that was constant. I was constantly getting the opportunity to do innovative things, to be able to document that and to be part of the movement. And I think always a big underlying part of the organization was policy, was advocacy, was making sure that we were in touch with our legislative leaders so that they knew what we were doing, the difference we were making, and so that they would continue to invest in us. I think one of the things that we also did well, and it's alive and well today, is that we were part of the Chicana movement and the student movement, but there were other movements like that. Our Native partners were also fighting the good fight, as was the Asian community and the Black community. And what we did that was critically important was we linked arms with those clinics, and we said, we're not going to fight for the dollars against each other. We're going to link arms and advocate for all of our communities. And we were able to create the Yauni Health Consortium, later the state association, and then the national association, so that we weren't fighting independently for those dollars. We were linking arms and doing that advocacy together. And when you do that, it changes the whole dynamic. And not only did it give us more fire, but also I think it made us stronger because when we didn't think of something, somebody else did. And, to this day, we share best practices and are still very, very much a part of, the work that's still happening. And I think we have some pretty wonderful, pretty beautiful accomplishments that have happened. And I think one of the ones I'm most proud of is the fact that we were able to get Medicaid, Medi-Cal for all immigrants, for all undocumented immigrants as well. And can you imagine, this was after the fights we had with Prop 187 and the referendum on affirmative action. And then now to say that as of January of 2024, the last age segment of our undocumented immigrants will now all be covered by Medi-Cal if they are income eligible. And that, that didn't happen overnight. That was a fight that was long and coming, and no nos dejamos, and we just stayed in the mix and stayed in the fight. And it was the right thing to do. But even today, I will tell our legislators that investment saves the system money. Just ask the emergency rooms. Yeah. Just ask the hospitals what would happen if we weren't in the forefront, if we weren't providing that primary care, and keeping people out of the emergency room as best we can. So I think that linking arms was a very important part.
Very, very, very interesting what you said. It's very inspiring. But it's necessary. It's true. It's a fight. But obviously, the only thing that didn't lack La Clinica was people who wanted to change, who wanted to make those changes, and you are a big example of this. Thank you.
And that's alive and well.
It's
still there.
It is, and continuing, and we celebrate that. Well, we have a hear about you and the beginning of La Clinica and all of this, but I still wanted to know the story of the mission and a specific goal of the clinic. Like a more, you are telling us what you did and what people that were working with you did in La Clinica. But now, can you tell about those, how did you thought in to bring mission, what the purpose of the clinic?
Mm-hmm. I think the original, I came in, when I came in, the clinic was already about 8 years old, okay? And so the leadership that established La Clinica, again, they were connected to UC Berkeley. Mm-hmm. Several were ultimately professors at the School of Public Health, so there was that connection to Berkeley, and that movement was alive and well, but it was rooted in Berkeley, so it was very special. But I think what we were seeing is that our families were suffering, and our families were being discriminated against. And I've never been able to confirm this, but there was a story, for example, that whenever the ambulance was driving up to a hospital and it had an uninsured patient, they would honk to let them know that there was an uninsured patient. I think it's true, but I have never been able to confirm it. But it speaks to, if it wasn't true, we believed it was true, and certainly our community members believed it was true as well. So basic access to prenatal care that ultimately we became known for providing, pediatric care, all of that was not available to our community. And that was so important for us to create that in a culturally appropriate way, in the language that people spoke, and to help people. We had a sliding fee scale. Nobody was turned away if they didn't have any money, and so that drove the organization, and that drove us. to do the things that we did. I will tell you that one of our commitments is to the board of directors, which is the majority of our board members are actually patient members. So it's our commitment to keep rooted in the community and to get feedback from the members, so that and they're not shy, let me tell you, so that when if something's not right, they will tell us. But that was very important from the very beginning to have that rooted. And I think the other thing was that I think we were ahead of the curve in was that, as I mentioned earlier, from the very beginning, we had dental services. From the very beginning, we had behavioral health services. And for the longest of time, those kinds of services were considered, they were out there they were marginalized. But we knew that they were important and they were part of our core from the very beginning. And I will tell you today that the number one reason children miss school is tooth pain. And post-COVID now, one of the things that we're seeing is that behavioral health and accessing services, that the stigma around that is going away, which is really, really good news. But the fact is that we had that comprehensive array of services from the very beginning, and that we appreciated that those were necessary and that they weren't optional services, but an important part of public health and of being healthy. I think the other thing that we appreciated and understood was the social determinants of health, because those are so rooted in social justice. And we knew, we have a little bit of time with patients, when they come in. We'll have that half an hour or whatever time we have, but it's what happens to that family, to that patient when they leave our office, what happens to them outside of our four walls, and how that impacts their well-being and their health. And we knew that, we understood that, because we understood that discrimination, that racism, that the obstacles that our patients were seeing was affecting their well-being. And we got it because so many of us had experienced it very directly. So, yeah.
No, incredible. And let me tell you a brief comment that, as a physician, once the children have a problem with the dentadura tooth, they are more vulnerable to other diseases. They compromise their immunity system.
That's right.
And
That's
thank
right.
you. Thank you for that. Me emociona mucho. Por favor, Nancy.
I just wanted, yes. I just wanted to say that as a first-generation student, growing up with Medi-Cal and having my own community health center in Montebello where I was growing up, I think it's very unique that La Clinica had so many services, and now they have buildings dedicated to just dentistry, just to mental health, just to behavioral health, and many others. So I want to ask, how did you get those sites into that area in Fruitvale, and what inspired those?
Again, it was our commitment from pretty early on. As I said, we added behavioral health services in our third year of operation, at the beginning of the third year of operation. And we were blessed to have the pipeline of students and the relationship that we had with the School of Social Welfare at Berkeley, that we were able to bring those students in. And from the very beginning, that was a commitment that we made to that. And once, with Alameda County, for example, we are very much a part of their system. In fact, I would tell you that the community health centers as a whole are their delivery system. But Casa del Sol, which is our behavioral health program there, is taking care of those patients that are the most complicated, that need the most case management. And so we understand that world very well. And I think because of that, it gives us unique opportunity to provide those services in a culturally and linguistically appropriate way. And I think that's it. But also, that commitment to the pipeline is, I've talked about Berkeley's School of Social Welfare, but those relationships are so critical to us. One of the big problems that we face, that our patients face, is what happens when they leave our four walls. And we struggle, for example, to access specialty care. And but we've developed relationships with Stanford, for example. We take care of their psychiatric residents, with UCSF, with UOP, and we're training their residents in endo, ortho, perio, all of those specialty dental services. And actually, it turns out that then our community has access to those specialty care services because of those pipeline relationships that we have, that they wouldn't have otherwise. You might not have that, even if you have insurance, that you might not have access to that. But because we developed those partnerships, and we've always been big in partnerships and knowing that we can't do it alone, again, to the point of linking arms and to taking on the battle with partners. And as a result of that, so we'll train our residents in the evening on Saturdays, and so we're maximizing our facilities. We're creating access for our patients who maybe are working, and so Saturdays and evenings is the best. And our patients are getting access to a service that they would not otherwise have. And that's been an important win-win for us, and we've replicated that over and over for optometry, certainly for medical, and definitely for dental.
Thank you. I'm so curious about how La Clínica and you define culturally appropriate healthcare, because you're based on your roots, and what does that look like then originally, and what does it look like now?
Yeah. Again, we get back to the issue of social determinants of health, mm-hmm. and when you're trying to, diabetes is a big problem in our community, mm-hmm. and when you're talking to a patient or to a family about the things that they have to change in their lives, mm-hmm. and you talk about nutrition and diet, you have to understand, what they're eating, mm-hmm. and how difficult change is going to be, mm-hmm. and you have to understand the culture and make it relevant when you're trying to implement change. Mm-hmm. And so I think that is part of the cultural relevancy that we mm-hmm. appreciate. And I think the other thing that we've done really well is set up support groups with other community members where they're supporting each other, and we're almost irrelevant. They're talking to each other about what has worked in making change in their own families, mm-hmm. and sharing recipes, etc. One of the things that happened with COVID is, again, the social determinants of health, food insecurity. Our essential workers were really suffering. All of that was very, very pronounced, and more than ever. Mm-hmm. And so we created relationships with the food banks. We now are able to document if a person has food insecurity into their electronic health record. So when a provider sees them, they understand that is happening. And so we're able to capture that information. But for example, when we do our food distribution now, again in partnership with the food banks, mm-hmm. it's not unusual for us to also be hosting a cooking demonstration, mm-hmm. with the food that we're providing that day. Nice. And that's been really, really successful. And who's embraced it really well are the kids. And they'll get on their moms too. I'm telling you, because I hear the stories about, they're picking it up. They're picking it all up, and they're being part of the solution, and it's wonderful to see. But yeah, I think during COVID, we were a big part of the solution, and that the social determinants of health were so prominent. I'm really happy to tell you that the public health department for Alameda County, for example, deputized us. So which is almost unheard of, but we were able to do tracing on behalf of the public health department. So, if you have an immigrant family, and you have a call, and it's the Alameda County, it's the county, you might not get the response. They might not even pick up the phone. But if it's a trusted partner, like Clinica saying, I'm calling you, and this is why I'm calling you, the results are infinitely different. And we had great success with that program and being able to do that tracing. And of course, we did a lot of testing and a lot of vaccinations afterwards, and are still doing that.
Really good, really amazing. I'm going to ask, what big challenges or barriers have you encountered in delivering health care, culturally appropriate service that you have been explaining already? But how, I think in my mind, what I understand is that you have been culturally appropriate from the beginning, because all of you obviously speak Spanish, and then you were meant to serve that community. But how was that process? To say, because you say also that the Clínica de la Raza doesn't discriminate against, but you were culturally appropriate for Spanish. How that's being addressed with the other communities?
I think it's holding ourselves accountable to that, and I will give you an example that as we were doing our COVID work, all of a sudden we became aware of this whole community of mom-speaking patients, and we didn't have very good capacity for that. But that was a growing community, and we kind of missed it a little bit, And so it was a big wake-up call to us that you have to have that capacity within the organization. And we were able to, fortunately, contract with some smaller nonprofits in the area that did have the language capability. And we were able to hire them on and help us. And, they were a subcontractual relationship. And we were able to build that capacity. So now we're acutely aware of that. But it caught us a little bit off guard, and you have to be humble enough to say, you know what, we didn't see that, and now we have to address it and change that. When La Clínica first started, I suppose that we were like 97% Latino, and it was mostly Mexican, and a large immigrant community. But that changed, and we started to see more people from Guatemala, from Honduras, from all the Latin American countries, and we had to adjust to that. But then as we started growing into Vallejo, into Pittsburgh, that there was a lot of diversity there, and we had to make those adjustments. And I will tell you today, La Clínica is about 67% Latina. And in Vallejo, where we have a brand new clinic, we actually serve more Black patients there than they represent as a percentage of population in that city. So it's about being humble enough to recognize that, you have a whole, and a constant self-assessment of what are you doing, and are we taking care of the people that are right here in our neighborhood. We take a great pride in, yes, we're about healthcare, absolutely, and we're about social justice. But we're also about economic development. And we buy from the community, we hire from the community, and we train from the community. And that has served us tremendously. If you walk into Vallejo, and I've done that recently, and you sit in the waiting room, the diversity in the patient area is so amazing. I always end up with goosebumps because it's so... You've got people from India. You've got people from speaking all kinds of different different languages, and it's we have in the waiting areas of each of the service areas. We'll have pictures of all the providers, and if you walk into dental in Vallejo, it's all people of color or women and because we are committed to hiring from the community. And so that part of the work is very important too, that economic development part of the work, and we're very committed to that.
Yeah, you've mentioned in your time being CEO and seeing the clinic evolve in all these years, can you provide some examples of advocacy and how you've been able to address those barriers of healthcare?
Let me check my notes on that. Well, certainly, what I've talked to you about. Oh, okay. Well, let me start with when Proposition 187 passed, and that was the anti-immigrant bill, and it was the attempt to keep immigrant children out of public schools, and eventually it was overturned. But when we were in the middle of that, one of the proposals that came out was that prenatal care would not be available to undocumented women. And we said, no way. So we were the lead plaintiff in a lawsuit that we brought against the governor at that time. And we were able to document the impact that would have, certainly on our community, but also on us as a business. And we were able to show what damage that was going to create, and we won that lawsuit. But I have to say that in doing that, we wouldn't have won it without the bravery of the women who were working with us, who stood up and said, that's right. And the courage that they showed to be, witnesses and to provide testimony, and the vulnerability that they had to show, but they showed that they had backbone, and that was absolutely incredible. And then we did it again with public charge, which was, again, an attempt to change it so that the rules that, if you were in the process of becoming a citizen and you had gone through the process, you could access public schools, you could access the delivery system. And the proposal was to eliminate public charge and to bar our immigrant communities from being able to access services. And this was the Trump administration. And we filed a lawsuit. We were the lead plaintiff. Again, there were a number of lawsuits in California alone. There were 3, but we were the lead plaintiffs here, and were able to provide documentation again to show the harm of that. And of course, we're very pleased that as of this moment, that has been retracted. But we were definitely part of that movement. And we've been involved in other movements like that. For example, just providing education in terms of sugar in our drinks. Mm-hmm. Vaping and smoking and those kinds of things that our communities were disproportionately affected by. We had a youth group, and they were doing a survey of some of the shops in the area, and they were able to document, and this was a state grant that we were able to secure as a result of their work, but how easy cigarettes were being sold to them without asking them how old they were or anything like that. But for example, the sugar in the drinks, I remember very clearly that in the dental areas, we had a poster, and it had a bottle of a drink, and then the liquid was not in there, but it showed how much sugar was a part of that drink. And I have some board member in particular whose kids have been patients in dental, and she goes, to this day I can't drink a soda. She goes, I blame you guys. But that kind of bringing it home and making the youth part of it, so they were the ones that were researching it and investigating, and they were vested in showing and demonstrating how they were being taken advantage of. It made all the difference in the world. Mm-hmm. And it's that kind of imagery that stayed with people, and they were able to this day, make some life changes that will stay with them and with their families. And we made a difference.
Yeah, that's amazing. You've talked a little bit so far about many of the initiatives that the Clinica has done, and some of the collaborations that you've had that have allowed you to continue to grow. And so I'm wondering if you could tell us a little bit more about how you've been able to grow as a clinic, and maybe particularly some of the challenges that you've had in that process.
Yes. Because historically the number of uninsured patients that we've had has been so big, we've struggled with infrastructure and keeping up with that, and often struggling with buildings that are made for healthcare and not something that we've converted to. We had a garage once. That was our main conference center, but it worked, and it was what we had. But that kind of lack of funding to help our infrastructure has been an ongoing obstacle, and we've been able to. I think you've gotten from me that partnerships are critical. You can't do it alone, and so it's something that I really enjoy doing. And so, for example, the Transit Village at the Fruitvale. It was done in partnership with the Unity Council, which is an economic development corporation, and we worked together, working on BART, on the city, to dedicate that big parcel of land to the Latino community. And originally it was the intention to create a parking lot there. And we said, no, no se vale, no way. And we came together with the Unity Council and with other partners, and we said, let's try this instead. We want a health center right here. Yeah. We want, these other services here. And we were able to, it took a while, but you know what? We did it. Yeah. So those working with partners like that, I mentioned the Alameda Health Consortium, which is the consortium of the 8 clinics that are part of Alameda, has also been part of our success story in terms of, bringing in other partners. Yeah.
I know that. I know that you have been having a lot of challenges in different stages of La Clínica de la Raza. But before we enter to what happened now as COVID, it would be possible to say something about the outbreak of HIV, AIDS in La Clínica. How do you take that challenge? It was in the 80s that this began, and I wanted to know if you have some recollection of that.
Yes, and I think from the very beginning, I remember our doctors talking together about that, and we were very clear that we wanted to make HIV/AIDS care integrated into the delivery care model that we already had. We wanted to make sure that it was that it was integrated to the care that we were already providing. So that meant that we were doing the intensive case management, that we were making introductions if a patient needed it to behavioral health services, so the warm handoff to another clinician. We wanted to make sure that there was an introduction to nutrition, and that was all part of the integrated health care that we were providing our patients. But we also, from the very beginning, have had health education. That's been a very important part of our work. And very early on, we started to do some outreach into the communities, and even into some of the bars, and we would have health educators there providing information, providing testing, providing referrals to services. And so really trying to make it, part of our community so that nobody felt that they were being targeted, or just that people felt comfortable coming and receiving the services. And so even to this day, it remains that way. It's an integrated part of our services.
Yeah, because if you let me, when HIV was an issue, a big issue in the healthcare, well, sorry to say, but by that time I was serving in La Clínica del Pueblo in Washington, D.C., and one of the main issues that people have, and I was adamant opposing, because they wanted to make a list of people that have, identified the patient. And I was saying that was creating a stigma from the government and from the community. And the big stigma for that time was that it was a disease that was only aligned with some behaviors, sex behaviors. And how do you manage that part? By don't get the patient get stigmatized for the clinica and the old administration.
Yeah, I think what you're saying rings true. I know what you speak of, and I think that's why we opted to make it an integrated part of what we were already offering, as opposed to having a special clinic just for that. So that people didn't feel like they were getting singled out. So now when we created our health education outreach, then we were able to target areas where we felt that we might reach more people, and that we would have a greater audience that way. But you're absolutely right, and I think also just understanding that, because we see a lot of children, we see a lot of women, and just to educate our own folks that this issue is not, it hasn't missed us. It is part of what our community is facing, and it is something that we have to address. Absolutely.
Great,
Yeah.
great. Thank you very much for the answer. Please,
Yeah,
continue.
and by addressing many of these issues, can you tell us about some of the unique and innovative initiatives that La Clínica has done, and what has inspired them?
We have so many examples. I'm so proud of our team, and they're so creative. Let the trunk pass.
Okay.
I think, for example, one of the innovative programs that we have is our dental goes into the schools, and we have 2 mobile dental chairs, and they go into the schools, and in one swoop, we will screen 300 kids. And in that screening, we're able to determine, okay, this child is okay, this one will talk to mom and dad, and this pobrecito. And just trying to do that screening and trying to get people connected, and not necessarily back to La Clínica, although obviously that was an option, but to other community health centers, to other providers, so that we were establishing a medical home or a dental home. Okay, so when you do that kind of screening, often you're putting out fires, right? And what we were trying to accomplish is, certainly we needed to put out the fire and take care of that child that was in acute pain, but also to connect them to prevention, so that they got used to that aspect of the care, and that they got used to going to the dentist 2 times a year, whatever that number was, so that we could take care of the entire family. And so then, as we went back the next year and we'd find a family that, you didn't follow through, that we would try again and again and get people connected. So I think that's one of the very innovative programs that we started in Contra Costa. And then when the word got out about it, it started to grow. And so now we have several efforts like that where we're going into the schools and providing that service. I think the other thing was we had the first school-based health center in Alameda County. and it was actually an elementary school, ironically. But with the departure of nursing, nurses in schools, having a school-based health center there was very, very important. And originally we really started with the medical model, and we had nurse practitioners in there. But then the feedback we started getting from our kids and why they were coming in was different. And they were telling us that they were getting bullied on the way to school, or that there were some things going on at home. And so actually what the kids were presenting with was behavioral health kinds of concerns and issues. And so we had to pivot. And yes, we had to have the medical services, but we also had to have the clinicians there to counsel our kids. And that was a big reversal that we had to recognize and acknowledge and make that change. So I think today we have about 12 school-based health centers. And then in addition to that, we also have the screening where we go from school to school and do some of that screening. So that was I think we were part of the initial movement to create that access in the schools. And I think what the beauty of it is that when we're there and we can see that child, that we can see that kid, they're going to go back in class likely. And so we're able to keep them there learning, and hopefully in less pain, and hopefully more reassured. So that's one example. We have another program called Care Neighborhood, where we actually have health educators, and we're working with other providers, the county sometimes, where we know there's a problem with a family, and we're able to go in and do intensive case management and connect that family to whatever else they need, whether it's food or other counseling or other services like that. More recently, we've been working on a program called Transitions Clinic, and we've been connecting with people, mostly men, who are getting ready to get out of jail or prison, and we connect with them before they come out, and we're able to interview them and talk to them and find out what they need, and to connect them to a medical home and connect them to Medi-Cal. So when they come out, they already have that kind of support. And I'll tell you, we've gotten some feedback like from moms going, I didn't know how I was going to work with my son, and you came in and you found us a medical home, and you made it so he could stay in my house, and what a difference that made. And so being able to help that person get onto Medi-Cal and helping them through the enormous paperwork that's a pain, and unless you know the work, it's pretty intimidating, and we're able to help them get through. It's a beauty, and people feel like they're getting a second chance, and that you care enough and you respect them enough that you're taking the time to do that and to help them, so that when they come out, they're ready to make the changes in their lives. So again, this is something we started in Vallejo, but we're being offered opportunities to grow that and do it in other areas as well.
That's really amazing, important work, for that community of formerly incarcerated peoples. We would love to hear more about how Clinica, it sounds like it's adapted to different community needs. What kind of work did Clinica do to address the COVID-19 pandemic? If you could tell us a little bit about that.
Yes, I think we were in denial for a bit, and then all of a sudden we were facing the closure of especially like dental clinics, for example. So we had to pivot to a number of things, for example, telehealth. And during the pandemic, we had just transitioned to a different electronic health record. So we were dealing with that as well. So we had a lot of challenges coming at us. But like in the Fruitvale, at the height of it, the positivity rates were like 35%. I think at one point it hit 38% of the people we were testing positive. So a big deal. We got creative though, and instead of laying off the dental staff, for example, guess what? They're really good at hygiene, and so we actually redirected some of our dental staff to actually do the testing. And it worked out really, really, really well because we were able to keep the medical staff in the, seeing patients through telehealth and otherwise, and then we had our dental staff out doing the testing, so we didn't skip a beat. We were actually even able to do dental out in the field, so we were able to check mouths and see what was going on, especially with children. And then again, we were working hand in hand with the public health department and essentially part of their team to do tracing and certainly testing and all of that. But what we saw in terms of the things that our patients were facing, then we were able to link arms with other providers, food banks in particular, and actually take food to people's homes. There were many situations where mom and dad had tested positive and there was, no tenían comida. And so we were actually taking food to them. And I tell you, the gratitude that people felt and expressed to us, golden. And, it kept us rooted in the effort. It kept us, it was a big impetus to keep doing the work. So today, that part of the social determinants of health are now institutionalized into our system, and certainly in terms of telehealth, it's made a big difference. And I can give you an example where one of my doctors was on a telehealth visit with a senior citizen, and the granddaughter was going to take her to the hospital. She wasn't doing well at all, and so they spoke to the doctor, and he said, "You know what? I think this is what it is. Let's try some antibiotics and see how that works overnight, and then if it doesn't, we'll talk in the morning, and then if it hasn't worked, then we'll get you into the hospital." Well, it worked, and so Grandma didn't have to leave the house. She didn't have to go find parking. They didn't have to go to the clinic or elsewhere in the middle of the night. They didn't have to go to the emergency room, and we kept her out of the emergency room. And that kind of story we got a lot of, and I think one of the outcomes is that now telehealth is here to stay. It's institutionalized. And for many of our communities where, again, they have to take buses or whatever to get to us, and we can offer a telehealth visit, golden. That's really, really a win-win for us. It's a win-win for the families, and we're doing our job in terms of not polluting the air.
Buenísimo. Bueno, de verdad que Jane Garcia have been really generous with all their answer, and I wanted to continue it, but I wanted to recognize that this way that you answer all our questions and the patience that you have with us, it's really, really amazing, and we really are grateful of that. But I wanted, it sounds repetitive, but during the COVID, you have mentioned two things. You have mentioned that you have to change from being patient to patient, in this amazing way of working for people, directly, and putting your program so direct with people, like the dental, like the behavioral, and the clinic, But this change of going transition to technology, let's say, to the digital world. It's good that you give us a great example of this doctor with the patient. But in general, how do you feel that you can put in place all your program and create this comprehensive, how, because we understand that many people in the Latinx community, they don't have a computer, but they have phone.
They have phones.
And how easy or how difficult have been this let's say no manager, but to tell the people, to spread the voice that the clinic is doing this, because for other clinicians I heard have been a little bit difficult for other institutions.
It's been a big hit, and I will tell you that particularly in behavioral health, it's really worked wonders with us. And I'll tell you that post-COVID, I guess it's post-COVID, we're still experiencing it, but anyways, that our number one pain point is workforce. And what we're seeing is that many clinicians have left the area. We're not generating enough workforce. We don't have enough nurses. We don't have enough staff. And it's really helped us, especially with behavioral health clinicians, when they can talk to a patient on the phone or on their computer, and they don't have to come in. It's really, really helped. And you know that our no-show rate, I think at one point we had like a 30% no-show rate, and with telehealth, it dropped to like 10%. So it made it much easier for people to access us, and our clinicians liked it, and our patients liked it. And one of the things that I think is really, that we're going to be able to use it with especially, is access to specialty care. So if I can get one of our partners, one of our institutions that has specialty care, and they don't have to come to us, or the patient doesn't have to go to them, and we can connect via telehealth. So that will help us get into the rural areas. It'll help us get into hard to reach places and provide services that they otherwise might not have been able to access. So in that sense, it's been really terrific. I tell you what, the other thing is that the digital divide that you were addressing really did surface. And we were able to use that as an advocacy arm, as an advocacy point too. And so we again worked with some of the other groups in the area to point out this this hole and this injustice, if you will. And so I think we were part of the movement that got the schools to provide all of their students with laptops. Right? To do internet. And so that the digital divide became part of my talking points in terms of the work that we had to do and that we had to address to bring parity to our areas. I think a lot of people prefer the in-person, but a lot of people are okay with telehealth, and it's now an added service, if you will, an added benefit that we're proud to provide.
Incredible.
But yeah, I mean, that tells you all, to go from 30% no-show rate to like 10, that tells you a lot. And we were hearing, like, especially again from teenagers who could take their phone and they could go somewhere else and talk to somebody about what they were feeling.
Yeah.
Yeah, that worked really well.
It's a point for the community, I can see. Yeah.
Yeah, thank you. You've talked a lot about how you've engaged and worked with a lot of community partners, and I'm wondering how you make that possible. What in your daily life, like, have you, in your daily actions as CEO, do you do to better serve the needs of those who need healthcare, and how do you talk to those organizations? How do you know which organizations to reach out to and all of that?
Yeah, a lot of that is organic, but a lot of it is also like, what community are you in, and what are the nonprofits that are there? What are they doing, and how might we work together? I think for us now, because we were 53 years old, the communities around us know us, and so we have the benefit of our work is known, and so where we can work together in partnership and complement each other's services, it works really, really well. And so we do that all the time. It happens to be one of my favorite parts of the job. I like meeting people. I like connecting with folks. And so I think that that's worked really well, especially with the learning institutions. And I tell you, with COVID, the nonprofit, the philanthropy, the foundations were really good to us too, where they were calling us and asking us what we need. And one thing about La Clínica that you should know is that we have angelitos. And I'll never forget, during COVID, we needed a computer platform. We needed an application to be able to document who we had tested, the results, all of that work. And so I remember my chief medical officer telling me, "We got to do this. I don't have any money. We got to do this. How much is it going to be?" Like $100,000. Yeah, do it. So I'm stressing. I'm trying to figure out how we're going to do it. The next morning, I get a call from New York City saying, "Hey, I heard about the work that you're doing, a foundation there, and we've got $50,000 for you." Oh, I almost cried. And I was telling him what I was going to use it for, and how I had just gotten this bill, and how that was 50% to my goal. And he goes, "No, you're not. You're 100% of your goal. I'm going to get you the other 50,000. And he did. But like that, the goodwill that people expressed and realized in a very important way was there for us.
That's amazing. It's been so amazing to hear about all the initiatives Clínicas led, and pioneered, and what do you envision for the future of Clínica de la Raza as work in promoting the health and well-being of the Latinx population here in the Bay Area?
I think it's very exciting, and one of the things that we've been pushing strongly is revamping of the delivery system. Mm-hmm. And certainly we're deep into primary care, but we're also heavy into the social determinants of health, and we've been advocating very heavily to make some changes in terms of the care team and who is providing what. And especially, I talked earlier about our pain point being workforce. And I'm really happy to have been part of a commission in California here on the future healthcare workforce. And we were able to make some recommendations that have now been adopted and implemented. And some of those, came very directly from La Clínica and what we needed. And that included community health workers, navigators, promotoras, which we had from day one at La Clínica, right? We engaged our community to come and work with us. And now they are being acknowledged and recognized as part of the care team, which means we get paid when we use that approach. And for us, what it means is that our limited clinician time can be coupled with, maybe it's the community health worker that follows up with the patient in terms of what do you need, can I connect you here and there, and so having the community health worker be part of the care team, or a panel manager be part of the care team, is really important. The other change in the care team is recognition of the associate MSWs. And during COVID, because of such high demand, we got a temporary approval to provide services with associate MSWs who were then, we would get paid for it. And it was such a hit that it has now been institutionalized and is now part of the delivery system. So there's lots of changes in what is called the CalAIM and Medicaid in California. And I think a lot of the things we were advocating for have been committed and are part of that change, such as CHWs and associate social workers. And so we're really pleased with that. And more recently, we had been promoting an alternative payment methodology So we were advocating that the state consider a couple of pilots throughout California so that we could test out, what if we use the community health workers? What if we use integrated behavioral health into the care team? And we were just selected to be one of the pilots. So I think reimagining what the delivery system could mean. And when I'm talking about community health workers being part of the team, not only does that expand our reach and the reach of our our physicians and our nurse practitioners, which is so sacred, but we hire from the community. And we're creating that career ladder so some of our youth and some of our women, some of our leaders can begin as community health workers, get exposed to what it might be like to be a nurse, and pursue that dream, and keep going through that career ladder. So not only are we expanding our reach, but we're developing and creating opportunity for our folks. I'm really excited that the use of community colleges. That's an opportunity there, because that's what our communities can more easily access community colleges and at least begin the journey there. And so I think reimagining what we can do there is really important. Again, it is our intention to integrate very intentionally behavioral health services into the medical model, so that it's one care team that's looking at all these issues.
Wow, this has been so nice. Thank you, both of you, and thank you. Now I'm going to ask you something that we should say from the beginning, but we didn't say it, and I hope our cameragraphers can edit all of this. Jane, you already answered our question beautifully, but we didn't ask for the consent in front of the camera.
And I brought you the consent forms. I did
No. We know that you, but it will be nice.
Yes.
If you can say your name and say that you agree with.
My name is Jane Garcia, and I'm the Chief Executive Officer of La Clínica, and it is my honor to be part of this video, and I consent with all my heart to do this interview.
And for the use
by the
proyecto de la crítica.
Proyecto de la ¿qué?
Okay. Alguien que diga el nombre del proyecto.
To use this interview for the ¿dónde está?
For
the Center for the Critical Study of the Health of Latinx Communities. I consent to for the use of this interview for your purposes.
Thank you.
Thank you. It has been a journey. I feel so honored and so lucky. I cannot express. You inspired. One last thing. Can you tell something to people like Nancy that they are undergraduate, they are beginning? A brief message for them, because we try to.
For Nancy Skinner?
No.
For
the undergraduates. For the undergraduates.
But
But it can be for Nancy Skinner.
For the
That will
next
be.
generation.
But yeah, for the
Latinx
next
students.
generation of Latinx, we this program have the backbone trying to revitalize the spirit, that spirit that you show when you participate in the clinic for the first time.
I think the message I would give to our youth is don't be intimidated and push yourself. And when you are uncomfortable with an opportunity or a situation, do it anyway, because regretting that you didn't do it is worse than messing it up when you. And I tell you, you will always gain something from participating. And so that's something that I've learned. in my own career is that, you know, it's not been uncommon for me to be one of a handful of women in a hospital board of governors where everybody else is the doctor and a male, and the majority are, you know, not women or people of color. And don't be intimidated by that. Even though you may feel it, you do it anyway. You show up. And so that's what I would say. And don't be afraid to fail. Be afraid of not playing. So show up.
And certainly that message can be taken for all our people, our Latinx community, and especially all those undergraduates that came with their heart trying to change the world. Jane is a proof of we can do it.
And I had the pleasure of serving as on the California Endowment Board, and so I joined it, and they get, okay, well, we wanted you to chair the program committee, which is where all the money gets distributed. One time, I'm onto the board 1 year. No, we want you to do it. And, you know, it would have been so easy not to do it, but you jump in and you ask for help if you need it, and you just stay at it. And if you make mistakes, you learn from them. But no te dejas.
Amazing, thank you.
Es importante, entonces quedamos con la lucha sigue.
La lucha
Y no
sigue.
te dejes.
Y sí se puede, sí se
Sí
puede.
se puede también.
Sí se puede.